Suppose a patient, a 13-year-old girl, is brought to the emergency department, comes to you due to head injury. And the patient was climbing a tree when she fell and injured the right side of the head. She briefly lost consciousness after the injury. On arrival, the patient is awake and reports pain over the frontal area, right frontal area, and has no focal neurological deficits. CT scan reveals there is right frontotemporal epidural hematoma. Neurosurgery is consulted. While waiting for the surgery, he becomes somnolent and he develops lower extremity, left lower extremity weakness. He has right frontal area involvement, but there is contralateral lower left lower extremity weakness. Pupillary response are normal. What may be the diagnosis? If you find this type of question, so think about the herniation syndrome. In here, there is a patient is traumatic epidural hematoma. Now he developed left lower extremity weakness while awaiting for surgery. So he has some sort of deterioration, some sort of herniation is happening. But uh, there is a mystery is that he has herniation. He has herniation in between these four, like subfalacine, like ankle herniation, like central herniation, like tonsillar herniation. In ankle herniation and in tonsillar herniation, what you need to remember then this type of herniation, like tonsillar herniation, usually causes fixed mid position pupils due to disruption of both sympathetic and parasympathetic innervation, and ankle herniation usually causes ipsilateral fixed and dilated pupil due to compression of the ipsilateral oculomotor nerve and accompanying parasympathetic fiber. But in this patient, there is no cranial nerve involvement, no pupillary involvement, and there is herniation of the cingulate gyrus underneath the falx cerebri. There is no pupillary involvement, consciousness often preserved, and there is contralateral leg weakness due to ipsilateral ACA compression. So it is subfalacine herniation according to the diagnosis. So it is subfalacine herniation.